are going to look at gastrointestinal bleeding. What is gastrointestinal bleeding? Gastrointestinal bleeding can be defined as bleeding or blood coming out from any part of the stomach or the gastrointestinal tract through the mouth or the anus. Blood coming out from any part of the gastrointestinal tract through the mouth or the anus. The main sign that will show that the patient is having gastrointestinal bleeding is blood coming out from through the stomach or coming out through the anus or the mouth. They are the main obvious sign. The patient may vomit blood, or the patient may defecate blood. He either vomit blood or defecate blood. This bleeding can come from any part. When there is injury in the esophagus, when there is injury in the stomach, when there is injury of the small intestine, when there is injury of the large intestine, or any part, the rectum, obvious blood may come out through the anus or the mouth. What are the causes of gastrointestinal bleeding? Causes of gastrointestinal bleeding. 1, complication of peptic ulcer disease. Complication of gastritis. Complication of gastroenteritis. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs. Taking of alcohol. Prolonged taking of alcohol can predispose the condition. Cigarette smoking. Taking of some chemotherapy drugs can result to gastrointestinal bleeding. Surgery on the abdomen, or abdominal surgery, or any surgery that involves the gastrointestinal tract will lead to bleeding through the anus or the mouth. Knife stabbing. When the patient is injured with knife on the abdomen, it can lead to gastrointestinal bleeding. Pathophysiology. Pathophysiology. The pathophysiology of gastrointestinal bleeding. A normal stomach or the gastrointestinal tract is firm, protected when there is adequate flow of blood to the mucosal lining. And when there is adequate blood supply to the mucosal lining of the gastrointestinal tract, the digestive process is efficient. But when this GIT is not adequately having blood supply, it will result to deadness of the mucosal lining. And this deadness will result to formation of crack of the blood vessels. This crack on the blood vessels will expose the blood vessels, leading to blood coming out from the GIT. Nicotine destroy the blood vessel. Destroy the gastric mucosa. Nicotine from cigarette smoking destroy the gastric mucosa. When this gastric mucosal lining is destroyed, the blood vessels are exposed. And when the blood vessels are exposed, blood comes out through or from the blood vessels. Another one is injury. Injury like knife stabbing. This may come from people that are fighting. It may come from people that are fighting. This can lead to bleeding of the gastrointestinal tract. Surgery of the abdomen can also result to bleeding. Surgery can also cause it, especially when the blood vessels are not properly sutured, or the blood may come out after the surgery. During the surgery through the anus. Surgery is another cause. Drug like NSAID, non-steroidal anti-inflammatory drugs, can cause gastrointestinal bleeding. The drug lead to mucosal erosion, mucosal lining erosion, and this erosion exposes the blood vessels, will result to bleeding. Signs and symptoms. The main signs and symptoms is blood coming out through the anus, 1. 2, blood coming out through the mouth, that's hematemesis, vomiting, or melena. The one that through the anus is melena, blood in stool. The blood may be either tar blood or frank blood. Tar blood indicate that the bleeding is coming out from the stomach when it is that's dark in color. It shows that the blood have been digested. Frank blood, when the bleeding is coming out through the frank blood, when the bleeding is coming out from the rectum, that's close to the anus, it shows that digestion have not taken place. The bleeding, presence of blood in the stomach irritate the GIT, which usually make the patient to feel nausea, and sometimes it results to vomiting, the vomiting of the blood. Clotted blood may be vomited, or frank blood may be vomited. Anorexia, the patient lost appetite. Weakness. Pain, the patient may have some pain. Medical management. Medical management. The history of the signs and symptoms of the disease is very important. The frequency of bleeding, the duration is very important. Lab investigation to show the presence of blood in stool. X-ray to indicate the location of the wound where the blood is coming from is very important. That's X-ray, ultrasound scan, the X-ray, endoscopy is very important to show or to identify the place or the wound bleeding is taking place. The nursing management, before the nursing management, the medical management. The patient may take cold drinks. Cold drinks are vasoconstrictor. This may constrict the blood vessels in the stomach. Proton pump inhibitors is very important to reduce the presence of hydrochloric acid, which may precipitate the bleeding. Antacid is very important, or may also be prescribed. Antacid, antibiotics, vitamin K to prevent bleeding. Antiemetics are given to prevent vomiting. The nursing management. The nursing management includes history taking. You take the history of the signs and symptoms of the patient, administer prescribed antacids, prescribe antibiotics, prescribe antiemetics, prescribe proton pump inhibitors, administer prescribe antibiotics, give the patient cold drinks to which may serve as vasoconstrictors, administer prescribed coagulant or a drug that can stop bleeding, such as vitamin K, administer prescribed fluid to increase the plasma level, administer prescribed blood for transfusion, or you may give blood transfusion as prescribed. Educate patient on lifestyle which may reduce the bleeding, such as stop taking of alcohol, stop taking of smoking cigarette, stop taking of drug that may erode the gastric mucosa, like NSAID, non-steroidal anti-inflammatory drugs. The complications of gastrointestinal bleeding. If gastrointestinal bleeding is not treated, it can result to anemia, severe anemia, or it can lead to anemic shock. That's the main complication of gastrointestinal bleeding. Any question? I will stop at this point. Feel free to ask any question. Like my channel, make comment. Before I round up, here is a tutorial question. Define gastrointestinal bleeding. B. List 6 causes of gastrointestinal bleeding. C. Describe the pathophysiology of gastrointestinal bleeding. D. Enumerate the signs and symptoms of gastrointestinal bleeding. E. Explain the medical and nursing management of gastrointestinal bleeding.